So in this video essay, we're going to discuss this gentleman who presented with rubeotic glaucoma in the context of diabetes. You can see here he's got florid rubeosis, lots of new vessels at the pupil margin, and his pressure was 60 when he came to see us, and it's been controlled medically at this point with Diamox. And here we're looking at the fundus. We can see neovascular change, and hopefully in the 3D you can just appreciate that these are vessels leaning into the vitreous at the junction of the laser. And the fellow eye, we do some gonioscopy. He's also got a macrohyphema, although this eye is presently fairly asymptomatic. And in the superior mirror, we can see that there's some blood, a small hyphema, and as we rotate around, we can see in that little mirror as we move round some blood in the angle, and here we can see some vessels there, some neovascular change. Now, we went on to do an aflibercept, and his pressure went up to 60 again, and he lost counting fingers. And here is the kit that every IVT suite needs: a box of NVR blades, a syringe, and a needle. And so when we realised that his vision had gone from about 6/9 to hand movements at the point of injection, and we did an eye care and saw that his pressure had shot back up to 60, I tend to do an emergency paracentesis at the slit lamp, although many people do it in the IVT suite where the patient's lying down. But in our practice, we have a slit lamp next door, so we brought him through. We got him set up. We have a speculum, asepsis with iodine, and I'm making the incision here. So I've got an NVR blade, which has got a swan neck, and now I've swapped the NVR blade for a needle, and I'm just putting a little bit of pressure on that posterior lip of the wound. And I've already put fluorescein in previously, and that makes it really easy to spot these little amounts of fluid that come out. And I do it in a very stepwise fashion. I don't want it to suddenly come down because these patients are at risk of suprachoroidal. And I'm checking his pressure with an eye care after each small amount comes out. This is done, doesn't have to be done all in one, as long as you do it relatively promptly within the next 15 minutes if you can. The goal here is to prevent central retinal artery occlusion. And this image is, believe it or not, the same eye, just 1 day later. So this is the next morning. He's now just got a trace of neovascular change. We could see before they had dramatic neovascular changes at the iris margin. And a few days on from this, these vessels became completely invisible. So while aflibercept is typically used for macular edema, which he also had, it completely reversed his rubeosis. This gentleman presented with a corneal abscess, which was superinfection from a dendritic ulcer. He's got a small hypopyon here. This is a single image.